I look forward to the conversations that we are going to have, and I welcome each one of you to, be part of this session in some way. So with that, I will hand over to the MC back. Karibuni, asanteni.
Thank you, Joyce. So we enter the next part of this session. We want to do a brief panel discussion. With me are panelists who are coming to join this discussion, and I'll introduce them in no order. We do a brief panel discussion, less than 30 minutes, so that we go to the next, so that you're able to understand essentially the Digital Health Agency and its mandate and work they do. So in no particular order, allow me to welcome Dr. Gregory Ganda. Dr. Ganda is a CEC member for Health, Kisumu County. Can we clap for him? He shall be followed by Dr. Angeline Chirchir, the CEC member for Health from Nandi County. Can we clap for her? Thank you. The next shall be Dr. Brian Lishenga. Dr. Brian Lishenga chairs the Rural Private Hospital Association. Welcome, Dr. Lishenga. Dr. Kariuki David is the CEO of the Kenya Medical Practitioners and Dentists Council. Dr. Kariuki comes to represent regulators. So a round of applause for him. We were expecting Hazel Koitaba to represent the CEO of SHA. Is she here? So we shall get her. And last not least, Dr. Daniel Mwai. Dr. Daniel Mwai is the Presidential Advisor on Health and Standards in the Executive Office of the President. Welcome, Dr. Mwai, and a round of applause for him. So first, I'll give a brief remark. As you all know, one of the key commitments of the President of the Republic of Kenya is the delivery of universal health coverage. And this is covered under the four pillars. One of the pillars is human resources for health. The other pillar is commodity security. And the last pillar is a comprehensive integrated health information management system, what you call the digital superhighway. So, the rollout of digitization and the digitization program. And with me here is a team of panelists that shall be able to discuss the key questions that are there. And I'll start with you, Dr. Ganda. So leadership is a very critical, important pillar in the rollout of this program. So the first question to you is, what is the role of leadership? And from your past experiences, what have you learned? Are there any steps we might have missed, the challenges, and what we need to improve on, using an example of what is happening in Kisumu County? Thank you.
Thank you very much, Dr. Thronera, for that question. I think I'll talk to it very broadly, because if I go to very specifics, then I might not touch on what has to come out. But you realize whenever you want to do any transformation or any radical change, nothing moves without leadership. And that leadership starts from political leadership. I want to take an example of the social health insurance. When we started talking about social health insuring and transforming the country many years ago, when we had the former president, Kibaki, and it was so-called Gilu Bill. That bill went and was passed in parliament and died there. It took us another 10 years. So before the politics decides that this is the way to go, and that one of the things that I think that the health sector succeeded in is making sure that this was an agenda of all the parties which were coming in. So the first is the top leadership in the political, and you have seen how you can pass bills and make them work within a short time if all the political leadership is in it. Now, coming back to Kisumu, where I come from, my governor, Professor Peter Anyang' Nyong'o, has been a strong believer in social democracy. And we can see when he became governor, this is the first thing that he put in the manifesto, that one, we must be able to take care of the indigents and everybody must get equal health care. Two, we must be able to digitize our systems. Now, he started all the way from the community health all the way upwards. And when we started doing this, it looked like a very expensive thing, and I'll take a very short time, that we asked the county assembly to pass a 130 million, which is almost 30% of the recurrent budget, to digitize community health systems. Now, that would never have passed through without political leadership. So the first agenda, and I think I'll end there, is if the political leadership decides that is the way to go, the whole system gets aligned, the whole technical team gets aligned, and resources are gotten to make sure that things work. Thank you.
Thank you very much. Dr. Angeline, just to build up on what Dr. Ganda has done and has said, you have your experience from Nandi County, you have heard what Kisumu County has been doing, and there's a critical role of political leadership. Share with us your experience about Nandi County.
Thank you. Leadership is critical, as Dr. Kand has alluded. In Nandi County, we've just begun the process of digitization of health services. We started in April by mapping out the service points to determine how much resources we needed in terms of the digital gadgets that we needed. We also needed to sensitize our health workers, and political goodwill is key because you need everyone on board, even including the members of the assembly. They are the ones who pass our budgets in terms of the expenditures. So without which, we may not be able to achieve what we desire. Thank you.
Thank you very much, and thank you for that. Dr. Brian, RUFA is one of the private hospitals, and you know private and faith-based hospitals play an integral role in delivery of healthcare. Secondly, is that you have been in different spaces whereby you have been advocating for a lot, especially in the healthcare space, change, digitization, issues of payment, share reimbursements and such. You are here with the decision makers, and I can see most of them in the room. First, it's to tell us your experience as private hospitals through this digitization agenda. And secondly, your proposed areas of improvement based on your experience as RUFA. Thank you.
Thank you, Dr. Thuranira, and thank you for this invitation. Now, as a representative of private healthcare facilities, we appreciate the change that has come through digital transformation, and we think that it is one of the most fundamental changes that has happened in the Kenyan healthcare space since independence. So we welcome it. We are looking forward to be part of it. But you ask me what has been our experience. So first, we are frontline healthcare workers. We deal with the SHA provider portal every day. We also interact with the registries daily. We interact with the HIE every day. And therefore, we have seen its successes and challenges firsthand. Now, let me give some of the lessons we have had. Number one, we discover that stability comes first. We think that no matter what kind of good rules or workflows you have, when the system is unstable, then the rules and workflows don't matter. So for instance, and we have been very vocal about things like OTP delays. We have been vocal about things like how they disrupt service delivery. Now, the other one is, another lesson we have picked up is predictability is as important as stability. So what do I mean? I mean that, for example, when we have a change in the rules, for example, eligibility, pre-authorization workflows, that kind of, to use a term, policy ambush, we need to make sure that we don't have policy ambush and we have a system that is predictable. Thirdly, we have learned that integration is very important. Let me explain, and I'm happy that Nandi County is on the digitization journey. You know, Kisumu is leading, Muranga has done a very good job. But as it is now, every single provider in the country, and I'm hoping, and I can see it's going to change just based on what I have seen from DHA, but every single provider in the country, whether public, private, faith-based, any hospital today is operating on 2 different platforms. So there is a lot of duplication and a lot of opportunity for error. So this is what happens. You see patients on one platform, maybe your HMIs, and when you come to dealing with claims, you then transfer and start working on a different platform. This has generated a lot of challenges. And I'm hoping that by the time other counties digitize, we should be in a place where you can work on one platform and be able to do all your claims, but also be able to see clinical workflows, inventory management, all that. Lastly, on this issue is support gaps. Now, one of our experiences has been that when you have an issue as a provider, do you talk to SHA? Do you talk to DHA? Do you look for the vendor? Who do you find? So we think that the future is a unified help desk that allows providers to get help at one go. So that if I need an issue to be addressed by DHA or by SHA, from a provider point of view, I should not know who I am dealing with. I should just have one single interface.
Thank you, Dr. Lishanga. Dr. Kariuki, KMPDC plays a critical role in the delivery of healthcare. You represent the regulators in this panel discussion. So you register facilities, you basically panel facilities, and then you also register healthcare workers and maintain a clean register of them. How has that role been achieved, and what interfaces have you had with the Digital Health Agency and or other intergovernmental agencies in the delivery of that service?
Thank you. Well, thank you very much for the invitation. I think in the recent past, we've seen a lot of potential in ensuring that we do integrate our systems between the various regulators and the various agencies within government and all stakeholders in the health sector, whether public, private, private for-profit, private not-for-profit, to ensure that services reach the people in a more organized manner. I think there has previously been quite a lot of silo, separate entities holding separate data. And we've just realized that we do hold quite a lot of information that we have even previously not been using. But now it's becoming more useful to ensure that we are able to provide services as should be given. And I think it also brings out the fact that there's still a lot of potential to harness more from what we already have as we collaborate towards ensuring that we achieve the vision that we have intended.
Yeah. Thank you. Dr. Moi, welcome to this panel. You are part of the team that came up with this great agenda. Take 2 or 3 minutes to explain to us what this digitization agenda looks like, and for Kenyans to understand where we started and where this agenda is headed to.
Thank you very much. I think the issue of digitization in the current era is almost self-explanatory. But I think the key important thing is the fact that looking at how healthcare systems have operated over time, we have had silo operations where, one facility operates somewhere in a remote area without any way of communicating with the other healthcare system. And therefore, the digital superhighway became an important component as an enabler of good service provision, quality access, the issue of people being able to pay for it, and also, availability of the same within the villages. And I think there are critical components that we cannot forget within this digital superhighway. One, the ability of people to identify themselves uniquely and to seek care within the facilities which are closer to them. The second thing was the issue of telemedicine, which became an extremely critical component in enabling even those in the remote areas to access quality care, even if the human resource challenge still persists, because it takes time to build up a human resource that, of course, will be available within all the physical locations of our facilities. The important thing that we cannot forget is the issue of the loss of our commodities that the country has had over time. So in the past,
So welcome, Waziri, to our panel discussion. We were answering questions from the panel. We are getting responses from the questions we have from the panel. So welcome, Waziri. So Dr. Mwai, I will paraphrase the question so that Waziri joins and understands. So you are telling us a brief about the digital superhighway agenda, where it's headed. With that, you can also answer the question on supply chain. What is the role of digitization in supply chain and commodity security and availability of commodities, especially against a backdrop of, it has been reported that there has been having commodity expiries and such. Thank you.
Thank you. So the highlight I was giving was the fact that when the healthcare system was disjointed and no one was able to see what is happening in one corner of the healthcare system, and inability to also track, the service delivery across facilities, then we used to have people come from a facility that is down there. They have to carry a file to go to another hospital after a referral. And if you don't get that referral, you don't get the file, then you go and start from zero in the new facility that you have gone to. So with the shared health record that was mentioned earlier here, this problem became solved. We also have had a problem in the commodities that we have in market. We have a lot of fake commodities that have not actually licensed to be in the market. But without digitization, you don't have a way of authenticating these commodities. And therefore, when you look at the digital superhighway, the component on track and trace of commodities, as well as the national logistic management system, it enables you to see as a policymaker, be it as a county, as a governor, be it at the Ministry of Health, the leadership there, be it at the executive, it is possible to see what are the stock levels of commodities that we have across all our facilities. And more so with good integration, what DHA is trying to achieve is to have both visibility for public, private, and faith-based. So the key essence of digitization is to unlock access, improve equity, so that those who have been left behind actually can access services. The marginalized can also be accessed. We get efficient way of delivering services to the people who require those services more. And this is the spirit that have enabled the birth of the Digital Health Agency, a new agency that is unique in its own way, and one of its type actually in the world, where we have very few countries that have been able to roll out a specific agency to handle the health digitization, because health is key for everyone. Thank you.
Thank you, Dr. Mwai. Dr. Angeline, I'm back to you. In your presentation, you told us that Nandi County had started the digitalization journey. You told us that you have already done the facility assessments and the trainings have begun. Just tell us the situation currently in the county, how far you are in that process, what have you done, and what challenges have you experienced? Thank you.
Thank you. I want to say that Nandi County is a toddler when it comes to digitization. We began in April with the mapping and redistribution of the gadgets. We adopted the Tibabu system, as was advised and supported by national government through DHA. And we began with the primary healthcare facilities. So those are the facilities that are integrated. The level 4 facilities are following suit. Why there was a delay is because of the modules that have to be configured to reflect the services that are delivered in those levels. Our level 5 facility, we are yet to connect to the system. However, I want to appreciate the fact that the key component is ownership of the process, starting from the top leadership of our governor, His Excellency Stephen Sang, because he's the one who launched the digitization of services. And that makes it easy down the chain. And also we sensitize our staff on the importance of this, because without their ownership, they are the champions, they are the implementers of the system. Now, what we've learned in the process is that we have attained about 60% digitization of the primary healthcare facilities with a dashboard that we are able to see what they are doing every day, the number of patients seen, the number of patients booked for the clinics. We are able to see the number of SHA claims that they are doing. We are also able to note the workload. We are able to see the facilities that have higher workload against the number of staff that they have. And this gives us an opportunity to redistribute the staff, where we find the workload is low, and yet the numbers are relatively higher than other facilities. I also want to say that one key component is knowing your facilities, knowing the needs of the clients and also the health workers, the ability to adapt to digital systems and use them. We found that we have staff who are above 50 years of age, and most of them have challenges. And I think going forward, those counties who are going to adopt digitization, when you go for training, the TOTs, it's important to select the younger staff population who are able to catch up and be able to push the process forward. Thank you.
Thank you very much, Waziri wa County and Nandi. So, Dr. Ganda, tell us the situation in Kisumu. Building up on what Dr. Angeline has told us, what they have done, 60% of the facilities being digitized. How is it in Kisumu now?
Thank you very much. I think Kisumu is younger yet older. Kisumu started digitization much earlier, and I think almost 40% of our facilities were digitized. But then all those facilities were silo facilities. That means that if you moved from facility A to facility B, you are a new person. You have to start afresh, they register you and get all your data. And so, yes, we were digitized, we had a lot of innovations, but then we did not have that interoperability layer being brought forward, even though we were even using the same system. We were mainly using Kenya EMR system in most of our facilities. We have now activated the Taifa Care system, and we will be now moving into the digital superhighway. The Kenya EMR system is being upgraded into a newer version that can be able to link. We will then be able to discuss on how we can save this data, because once you start generating data, initially, most of our data was in several places because of the partners, and you know the USAID and the US government is transitioning into a locally run system. And so the DHA will have to provide at one point a repository where all this data will be coming into. Once they have provided that, we will have to change the kind of tablets that we have, because we have been paying for the internet. The partners have been paying for the internet, and we have been supplementing this so that we're able to have all-round internet in our facilities. I think coming in with the DHA will allow us now to have internet provided for all those facilities. Despite all this, yes, We still have challenges with internet connectivity in the whole county. I think Kisumu, Homa Bay has better internet than Kisumu. We are at 60%, Homa Bay is at 90%. So we have been able to buy Starlink to boost this internet so that all our facilities are able to get internet. And then we will be all of us together in the digital superhighway as Kenyans and not silos. And I like saying that counties are independent governments, but they are interdependent and work closely with the national government. So as we do our innovations, yes, we are working together with national governments to make us move forward. Thank you.
Thank you. Thank you for that. And I'm happy that you have become proactive, facing your challenges head on and sorting them out. Dr. Lishenga, what is the status of digitization of the private facilities and FBO, and where can DHA step in to support? Thank you.
Thank you, Dr. Turanira. I would say, so we did a survey 2 years back on the status of digitization. And what we found out is that for private and faith-based facilities, about 60% of them operate, are digitized. So we still have somewhere between 40% gap. Now, in terms of where DHA can come in to support, my conviction is that we need to move to co-creation and start doing things together. So for instance, one of the things that is very exciting is to see counties like Nandi County, taking up HMIS systems. We need to support private sector and faith-based hospitals to do the same so that they can, and this can happen through validation of existing HMISs within the private and faith-based. So one of the things that DHA can do is, because private sector will operate slightly differently, is to move to an open source kind of arrangement where you validate the HMISs that are out there and find out whether they meet the criteria set out by DHA. Another opportunity is, I think, in incentivizing facilities that do the right thing in terms of digitization. So for example, real-time claim adjudication can help facilities unlock capital. So, and I had Mwai talking about the supply chain. Real-time claim adjudication can help us with unlocking inventory, for example. So we think that working to co-create with private sector is definitely the future for DHA.
Thank you. Thank you very much. Dr. Kariuki, as a regulator, what is your experience in regulating facilities and regulating healthcare workers? And how can DHA help you sort out all the challenges that you experience, as you give us your parting short remarks?
Thank you. As regulators, we implement government policy through legal frameworks. And so ours is largely to keep minimum, the standards and norms that are expected to be able to provide quality care for the needs of the population. And we do continuously support facilities to be able to maintain the standards or even take them higher than what they have been having. In terms of the health professionals themselves, we also maintain the standards right from the training, then ensure that everyone is registered and licensed to practice within the scope of the training that they had achieved. Okay. For example, when it comes to the health facilities, 2 years ago, we only had about 10% of public facilities voluntarily applying for their annual licenses. But with the reforms that have come, we are currently at 97%. Okay. And the remainder is largely from the investments that they keep making. So there's a lot of work going on.
Thank you. Thank you very much. Dr. Mwai, a quick question. What's the way forward now after this? What's the way forward? You have seen what you have done. You've seen what DHA has done. You have had the challenges from the county governments, challenges from private and faith-based facilities. Give us directions on which way we head after this.
I think the key call is that the DHA is ready to work with the counties, and I think this has happened. And the call is for the counties to work with the Digital Health Agency to roll out the digital superhighway, address the issues that are happening within different counties, unique to them. And I think the ultimate is when we have a complete superhighway where the DHA is running it with the critical support from the county governments, and that will give us a successful integrated healthcare system. Thank you.
Thank you very much. Help me thank the panel that joined us. The panel, you may now exit the stage so that we go on to the next part. Thank you very much, Dr. Angeline from Nandi County. Dr. Kanda, thank you very much. Dr. Lichenga from Rupa, thank you very much. Our CEO, KMPDC, thank you very much, and Dr. Mwai. At this juncture, allow me to welcome Dr. Engineer Anthony Lenayara for a brief remark and to welcome to usher us into the next part of the program. I've been your host, Dr. Thuranira Kaugiria, and thank you very much, good people. A clap for our CEO, good people.
Thank you, Dr. Tunarera and our panelists. CS for Health, Honorable Ndwale, EGH, Governor's Presence, DG, Chairman, Digital Health Agency, and our board, CEOs present, CEO SHA, CEO KEMSA, CEO KMPDC, all protocol observed. Good morning. Good morning again. Waziri, welcome to this side event. This is a side event for the Digital Health Agency. I'll just give a few remarks and then we move to the next part of the program. We are here today to assess ourselves on how far we are for the last 1 year. 1 year ago, we declared that the future of healthcare will be universal, accessible, digital, connected, and inclusive. We recognize that our people deserve more than just basic healthcare. They deserve a system that works for them, whenever they are and whenever they need it. Today, as we gather, we want to evaluate how far we are on this. What are the gains? What are the opportunities? And where are the pains? Just to give you a high level, in 12 months, we have made significant progress as the Digital Health Agency led by our CS and our ministry in digitization transformation agenda. As we sit here today, we are rolling out Taifa Care Hospital Management Information System that makes each and every public hospital to go paperless. We are in 24 counties and counting, and we expect to complete in all counties by November 2025. Our health information exchange is also live and working, making identification of systems across the 25 million Kenyans who are in the UHC program possible. Every patient today is uniquely identified through the client registry integrated to our registration bureaus, eliminating the need for physical health records and physical health cards, and preventing fraud under the Social Health Authority. All healthcare facilities and professionals are now uniquely, seamlessly identified through our regulators, eliminating fake doctors and fake facilities and provision of services by unqualified health professionals to the Kenyan people. Patient portability is now a reality in Kenya. Our shared health record today is able to move data and information of patients from one hospital to another in all the hospitals that we have done the Taifa Care rollout. This not only eliminates the need for big files and documents across, but also duplication of charges for simple things like tests of X-rays and MRI for Kenyans by different facilities. Our social health authority is now fully digitized. Kenyans today can register in the comfort of their home for the social insurance. They don't need to know anyone. They don't need to go to any office. They register at the comfort of their home. That's why today we have 30 to 50,000 Kenyans registering without anybody asking them to do so, because they can register at the comfort of their home. We have gone further. As we know, not everybody has a smartphone, to introduce simple solutions that help the Kenyan people at the rural areas to be able to access to the Social Health Authority. Our USSD code, *147, is fully functional, and it represents the whole government, because it means one government and 47 counties. Kenyans without smartphones are able to register from their USSD. Pre-authorization used to take, under the previous NHIF, between 72 hours to 3 weeks. Today, you get your pre-authorization codes approved in less than 15 seconds. This is efficiency, and we have ensured that our Social Health Authority is fully digitized and provides services efficiency. As we continue with the digitization, we take note that technology cannot serve without having an efficient and digitally enabled health workforce. We are training all our health workers from every public facility. We are training them how to use our digital systems and use our digital platforms to provide services more efficiently and treat Kenyans the quickest way possible. We have so far distributed 15,000 devices across all the facilities that we are doing rollout, and we will distribute 74,000 devices to each and every health worker in a public facility or a public hospital. These devices comes with internet, paid up within the program to ensure that no health worker is not able to access internet to provide services. These are not just achievements or statistics. They represent real life being impacted across the country. However, throughout the last 1 year, we have also faced some challenges. One has been the connectivity issues, which we are currently addressing together with our Ministry of ICT to ensure that each and every hospital has stable power as well as has connectivity and internet. Two is the change management, training people to leave the paperwork that they are used to and start using systems within the Taifa Care ecosystem. This is still a challenge we are working together, and we are working together with the counties. Our training programs is embedded in the county government's workforce to ensure that they not only understand how system works, but they embrace and understand the importance of it. There are still a lot of opportunities. These are just foundations that we have created to ensure that Kenya has a fully integrated, intelligent health ecosystem. We call upon each and everyone to come and partner with us to ensure that Kenya becomes smarter and digitally enabled. Aligned with the Ministry of Health strategy, we today are going to launch 3 key documents that are going to govern how we provide digitization. One is the Digital Health Agency Strategic Plan, which gives our future and our ongoing plans to ensure that we achieve the universal health coverage digitally. The second is the certification framework. We still have systems that are within the ecosystems that are not certified. And today, we give you a framework of how those systems can be certified and plugged to the superhighway. These strategies align with the overall goal of the Ministry of Health Universal Health Coverage Agenda, and will ensure that every digital health innovation in Kenya meets the highest global standard, built for scalability, security, and sustainability. Thank you so much, CS for Health. I think that was my short speech. I want to welcome my colleagues, CEO Shah, just to make a brief speech, and then we can proceed from there. Karibu. We and Shah are like twins. because we digitize SHA, and sometimes the Kenyan people don't know the difference between DHA and SHA. But see us as twins that enable one another to ensure that the Kenyan people are served and served well.
Thank you. Thank you, Engineer Anthony, for this opportunity to address the team here. I think at SHA, what we can say is that we are really benefiting in terms of the thinking of this Taifa Care initiative to be able to have end-to-end digitization of the claims processes. When we came in, the panel before was sharing really the way forward and what this will look like. And I'd like to borrow the remarks of Dr. Moi. Once upon a time in Kenya, there was very little visibility of when a patient would walk into a hospital, the services that they would get, the lab work that would be done, the treatment protocols that were issued, and then the discharge of the patient, and even the follow-up of the patient. But with our collaboration with the Digital Health Agency, we now have back-to-back full-end visibility of a patient and a patient's journey. And if we look at what is coming up next, what is left undone, which we are working on, is that every Kenyan will be able to have access to their record of services. It means you as a Kenyan will be able to know in January you went to the hospital, 2 years later in February you had your CT scan, 3 years later you went in for this surgery, and that really is monumental for us. One, as we adjudicate claims, but two, for you as a patient, as we make sure that you get quality health services. And then for us in SHA, our partnership in DHA continues. And really, if you look at the work that has been done from the inception of this program to date, we're extremely pleased and there's more to come. As highlighted by Engineer Anthony, in the last few weeks, we've already activated key technological solutions. One is biometrics, and as we continue rolling out and reaching our lower tier hospitals, it means that every Kenyan will be able to protect their cover, they'll be able to access their cover, will be able to pay for the right claim. If you look at the Healthcare Workers app, again, it allows for us to ensure that you get the services that you need from a healthcare worker who is not a quack and who then has offered you a service. And so for us, we're really seeing a lot of investments in technology that have helped us and that will help deliver the dream of UHC for Kenya. So thank you, Engineer Anthony. Thank you.
Thank you so much, my sister, CEO SHA. Waziri, now I want to welcome the World Health Organization representative to make his remarks before we proceed. Karibu sana.
Honorable Adam Aden Duale, Cabinet Secretary for Health, PS for Medical Services, Dr. Uma Oluga, the CEO, SHA, Dr. Mercy Mwangangi, the CEO, Digital Health Agency, Engineer Anthony Lenayare, governors, county health executives, distinguished partners, ladies and gentlemen, good afternoon. On behalf of the World Health Organization in Kenya, I thank you for this opportunity to join you at this Devolution Conference convened under the banner for the people, for prosperity, and devolution as catalyst for equity, inclusion, and social justice. This side event focuses really on how digitization advances equity, justice, and inclusion, speaks to the heart of the promise. For WHO Kenya, this conference is pivotal. For us, we gather here today in Homa Bay County, not merely to reflect on progress, but to chart a bold and inclusive future for healthcare in Kenya. One that is powered by digital transformation, anchored in the conference's central theme of equity, justice, and inclusion. As we stand at this intersection of Kenya's devolution journey and its digital health revolution, we witness firsthand how digitization serves as a powerful equalizer, breaking down barriers that have historically prevented Kenyans from accessing quality healthcare services. Today, I speak not just as a representative of WHO, but as a partner deeply invested in Kenya's remarkable transformation into a global digital health leader. Let me frame the why for this side event about digital health for equity, not just for efficiency. Recently, WHO member states extended the WHO Global Strategy for Digital Health 2022-2025 to 2027, and actually even requested for a next phase for 2028 to 2033. The signal from WHO member states is clear. Digital transformation must be people-centered, rights-based, and explicitly advance universal health coverage. WHO's guidance on ethical use of AI, especially the LLMs, reinforces this imperative to deploy innovation where it measurably improves outcomes and protects populations. Regionally, we do have the WHO Afro implementation framework, which guides the countries, including Kenya, to translate this strategy into action through governance, workforce capacity, interoperability, as well as equity lens, principles that align with the devolution. For Kenya, we are very proud of the great work being done here. There is an enabling environment, very strong political leadership of this initiative, strong laws, and clear rules. Indeed, Kenya has built one of Africa's most legal foundations for digital health. The 4 pillars really matter for this conversation. One is the Digital Health Act, which establishes the Digital Health Agency and mandates a comprehensive integrated health information system. The second is the Digital Health Regulation, the legal notice number 76 of 2025. There is also the Social Health Insurance Act and the Primary Health Care Act, which links the financing and service delivery so digital tools translate into entitlements as well as access. Finally, there is also the Data Protection Act. This clarity that these legal frameworks have provided is timely and welcome. As has also been noted, we look forward to the launch of 3 strategic documents by the Cabinet Secretary, the Digital Health Agency, Digital Health Authority Strategic Plan, the Digital Health Solution Certification Framework, as well as the Digital Health Authority Standards and Guidelines. For us, these are not just policies, they are instruments for transformation. Distinguished partners, ladies and gentlemen, let me just say a few words on equity in action, especially the community platforms, data flow, and claims. As has been shown, the Kenya's 108,000 plus community health promoters brings service closer to households. The electronic community health information system now connects the community encounters to facilities and the Kenya Health Information System, thereby accelerating decisions and closing referral loops, as has been referred to. These are real equity gains for Kenya, especially in the hard-to-reach settings. On the financial end, the SHA has stabilized digital claims processing, a very essential step to turn service delivery into timely payments. Just a few words again also on the devolution advantage and counties, especially counties as engines of inclusive digitization. The devolution brings proximity needed to design for language, literacy, connectivity gaps, disability inclusion, and gender dynamics. This also, the human rights and social justice framing of today's program is therefore for us the correct lens. It measures digital health by who benefits first, not just who is already connected. For WHO, we provide 5 design tests for equity, justice, and inclusion. For us and for the global health community, before any solution scales, WHO proposes that counties and vendors must pass this test. 5 of them. 1, access. The system must work offline, degrade, and also be able to degrade gracefully on low-end devices, 2G or 3G. 2, usability. The contents in Kiswahili and relevant local languages, low literacy designs are essential for usability. 3, safety. Clear clinical scope, human oversight. 4, protection as well as accountability, which logs, metrics, and user feedback loops made accessible to counties and communities. From the discussion so far, these are already being put in place, so this is really great for the government of Kenya and the leadership. Looking forward, we want to propose some practical steps that the country needs to fully examine, learning from best practices from around the world. In this regard, we want to propose county compact for digital health. And I will just give some 3 near-term commitments. To translate the principles outlined already into practice within the next 12 months, let us agree at this conference to have 1 inclusive service charter per county for digital health, which includes the language disability features, grievance channels, uptime targets. Second, 1 certified stack for priority use cases. For example, antenatal care immunization, NCDs per county, also procured against the DHA certification framework. 3, 1 protection drill per county. We ensure that, especially at this point where we have issues of hacking, we also propose as part of this compact 1 protection drill per county annually, some form of tabletop exercise, because as you will agree with me, if there is a breach in the data, it will have significant impact on the rollout of this initiative. So going forward, WHO's role and offer to Kenya will include strengthening the governance and safety, advance data stewardship and trust, scale up equity, primary healthcare digitalization, and we also provide you global platforms to align your resources and work with you on benchmark progress openly. In conclusion, let me reaffirm WHO's unwavering commitment to working alongside Kenya on this remarkable digital health journey. Together, we are not just digitizing healthcare, we are democratizing access to quality health services for every Kenyan. The future we envision is one where a mother in Turkana can access the same quality of digital health services as one in Nairobi, where a community health promoter in Homa Bay has the same digital tools as specialists in Kenyatta National Hospital, where equity, justice, inclusion are not just aspirations, but actually everyday reality for Kenya's digital health ecosystem. WHO stands ready to continue this partnership, supporting Kenya's vision of a digitally inclusive health system that leaves no one behind. Together, we will ensure Kenya's digital health transformation becomes a global model for health technology that can actually serve humanity's highest aspiration, as well as that of all Kenyans. Asante sana. Asanteni sana. Thank you.
Thank you so much. Because of time, I will invite Chairman of DHA just to say one word. DG, please come closer, and then DG to take over the program and conclude. Chairman, DHA, please.
Our Cabinet Secretary, Honorable Haden Duale, our DG Health, Dr. Amoth, WHO County Representative, Chair Health COG, digital health stakeholders, national and county government officials present, conference delegates, ladies and gentlemen, good afternoon. Welcome to Digital Health Side event. The DHA has been in existence now for 1 year. And as chair of DHA, I'm happy to report that we have navigated through both operationalizing and as we began, we are implementing in earnest the Digital Act 2023. And like we always say, we have done what we thought, much more than we could do. And we are born and we are already running. The agency recognizes its monumental role as a crucial enabler in the delivery of universal health coverage through use of technology to transform how health is delivered. In the past, the DHA, through intentional collaboration with partners, has been able to deliver digital solutions that are boldly contributing strategically towards improving how healthcare is delivered in this country. Esteemed conference delegates, investments in digital health hold great promise for transforming healthcare systems and improving health outcomes. It is our aspiration that digital health transformation will result in improved clinical experience, increased health provider satisfaction, increased accountability and efficiency, resulting in overall improved quality of healthcare. That is preventive, promotive, and curative. At the agency, we are inspired by the Japanese Kaizen philosophy towards continuous improvement. Today, we get an opportunity to reflect, that is, smile at what went right, learn from what we did not do as planned, and visualize what the future holds as regards optimal digital health transformation. Ladies and gentlemen, in conclusion, the agency is launching its first strategic plan today. This plan reflects a shared national ambition to build a resilient, future-ready, and people-centered health system. On behalf of the agency, we sincerely appreciate all who have been part of the DHA's journey. The commitment and support from Ministry of Health leadership, led by our indomitable CS, Aden Duale, has also been truly inspirational. Thank you so very much, Wasiri. Asanteni for joining us today. I now welcome our DG Health. Take over.
Thank you, Chair. Honorable CS, allow me to ride on prior established protocols because of time. The transformative journey towards digitization of health services in Kenya has begun, and great progress is already demonstrated. Coverage has already reached more than 50% of the countries, and we are on track to be able to achieve 100% coverage before the end of the year. And we are already celebrating the dividends of this investment, as clearly highlighted by the CEO of Digital Health Agency. We have reduced turnaround time for our pre-authorization processes. We have upped our fraud detection mechanism, and through track and trace, we have enhanced our capacity for pharmacovigilance and accountability in our processes. Data is the new currency, and now we are collecting real-time data. And this data is also hosted in-country, and therefore it is easy for us in terms of decision-making. This work is not only taking place at the facilities, but it's also happening at the community level. We have the electronic community health information system that also collects data at the household level. We are soon joining the League of Nations, who collect data on a day-to-day basis, real-time, rather than wait for periodic surveys conducted every 5 years, like the Kenya Demographic Health Survey. Therefore, this is the right thing to do, and for sure, it is going to have a transformative change in our health ecosystem. Allow me to invite His Excellency the Governor of Tharaka Nithi County, who is also the chair of the Health Committee at the Council of Governors, to make some remarks and thereafter invite our chief guest for the event. Your Excellency.
Thank you very much, Dr. Omoth, our substantive DG, Honorable Hadan Duare, the CS for Health, and for the sake of time, all protocols observed, I recognize you all and I salute you. We are running against time because there's another event taking place here, and for that reason, CS allow me to make very brief remarks. First and foremost, I want to thank the DHA team led by Engineer Anthony. From where we sit as the Council of Governors, their partnership has not been without hitches, but it is one of the best agencies we work with, because from where I sit, DHA has gotten us from a habit that we had in Kenya, where we used to have a book called Kitabu ya Hospitali. It used to be half a book, and our patients used to carry them along with them everywhere they go. And the biggest killer of patients in Kenya was not the wrong diagnosis, it wasn't lack of medicine, it was inconsistency of health records that made doctors treat patients who are referred with the same treatment they had in the last previous treatments or visits, without realizing that that was not working because there was no record. The birth of DHA from the three laws that were passed courtesy of Kenya Kwanza, has come to resolve this problem. And our patients are very happy nowadays, walking to hospital, carrying nothing, and they find their records there, even the records of the hospitals they visited before from their previous visits, which are not necessarily the same hospitals. That is a game changer. We are looking forward to a time when a patient in Kajiado will have the need to be seen in Bagathi, and they just walk in, give their ID card, and their records will be there, with their data being correct and also protected, because that is very, very important, not just to us as a country, but also for the patients. So data protection is something that we need a guarantee on, Anthony, because that has been our biggest worry as Council of Governors. I'd also like to, at this particular time, hail you for giving us a promise to give us end-to-end visibility, which includes a dashboard for the CEC in charge of health, also the governor. And I am briefed that that system works on and off, but I'm sure with the effort you put to reach out more counties, this is an issue that will be resolved. Lastly, counties had existing systems or digital health systems. Some of them were inferior to what DHA is offering. Some of them have resistance in accepting DHA because they feel they have had an investment. But if you're giving me a Ferrari and you're telling me to crash my VW, which is very old, I would have to make my calculations whether the VW serves any purpose. We are therefore urging the county government, if you have a system that's inferior to DHA system, it does not matter how much you invested in it. If the DHA will serve, with the DHA system will serve you better, you had better take that one. With those very few remarks, it's now my humble duty to call the CS Health, and even as you comes, and let's give him a clap. Counties have committed to give free treatment in level 2 and 3 and 4, but CS urge patients also to make sure they register for SHA, because you cannot get treatment if we don't know who you are. They must register. Thank you very much.
The Chair of Health Committee of the Council of Governors, Excellency Governors and Deputy Governors, Senators, Honorable Members of Parliament, County Assembly, senior national and government officials, our partners, distinguished guests. Ladies and gentlemen, it is my distinct honor to attend this year's Devolution Conference in the beautiful county of Homa Bay, as we reflect on the theme for people, for posterity, devolution as a catalyst for equity, inclusion, and justice, social justice. I am particularly delighted to contribute to this dialogue from the perspective of health care digitization. Universal health care remains one of the most important, powerful tools for advancing equity, justice, and inclusion. Yet many Kenyans, especially in the remote and under-served areas, still face barriers to timely, quality, and affordable health care. Digitization offers a unique opportunity to bridge these gaps. It is more than technology. It's a transformational tool for efficiency, for accuracy, for equitable access, for transparency, and for citizen engagement and empowerment. The Ministry of Health has made digitization a core pillar of the ongoing health sector reforms through very key initiatives, including the Taifa Care digital platform, which integrates healthcare records, telemedicine, insurance management, facility data, and to make sure that we provide care, we prevent fraud, and we improve patient safety and experience. We are also doing community health digitization through the Smart Chap app. Community health promoters can now register households, report illness, track maternal and child health, and make referrals, hence boosting our surveillance, our responsiveness, and our accountability to the people of Kenya. On supply chain and resource tracking, we now provide real-time monitoring of medicines, vaccines, and medical equipment, reducing stockouts, wastage, and disparity. And finally, on health financing and inclusion, using our digital IDs and mobile money to enroll vulnerable population into the social health insurance, hence enhancing financial protection and reducing unnecessary cost. Ladies and gentlemen, devolution has been a game changer in aligning health priorities with the local realities. Counties are best placed to implement innovations that meet the specific needs of their population. The Ministry of Health continues to work closely with the county governments in the rollout of digital health infrastructure at all levels. We are working with you to build capacity of health workers and ICT officers. We are working with you to strengthen data governance, privacy and cybersecurity, and we want to make sure, colleagues and partners, that equity is not an outcome, it is a deliberate choice. Inclusion and justice in healthcare must be embedded in our system design. We want to ensure that our platforms are accessible to persons with disability. Our platforms are available in local languages. Our platforms are gender responsive. And our platforms are affordable to all. No Kenyan should be left behind in the digital health revolution, regardless of their location, their income, and their identity. Kenya digital health transformation is here and is real. It's reshaping how we deliver care, improve efficiency, and safeguard public resources. Through the Social Health Authority, the ministry is using technology as an engine for equity, accountability, and trust. Since October, SHA has disbursed 57.7 billion to health facilities, and of these, 49.7 billion was channeled to the Social Health Insurance Fund and emergency, chronic, and critical illness, while 6.7 billion supported the primary health care fund. And let me make it very clear here. Our primary health care fund is the one that makes Kenyans to access outpatient in level 2, level 3, and level 4 free of charge, paid by the government of Kenya, appropriated and budgeted by Parliament. When fully integrated, biometric verification will work with real-time claims processing, enabling instant eligibility checks, faster reimbursement, and accurate data, patient data across all our counties. Beyond fraud prevention, this system builds citizen trust and provides actionable insights on service use, on the trend of diseases and spending in order to allow us to make smart investment and fast response. Ladies and gentlemen, Kenya experience demonstrates that digital health innovation, when anchored in sound policy and sustained by strong political will, as shown by the President and the government, and those of us who work with him and our county governments, we can deliver a patient-centered, fraud-resistant, data-driven health system serving a model for Africa health resilient agenda. And in this spirit, today is a significant milestone with the launch of the Digital Health Agency Strategic Plan, alongside other guiding documents. This will serve the compass for advancing our nation's health digitization agenda. In conclusion, we reflect on the next frontier of devolution. Let us reaffirm our collective commitment to equity, justice, and inclusion through technology-enabled health system. The Ministry of Health stands ready to walk this journey together with all our partners, all our counties, and our communities. We will close the gap and we will open the future. With those many remarks, it's now my duty and honor to launch the Digital Health Agency Strategic Plan. Yeah. Please, let's clap for DHA. You will not expect hard copies. This is digital. Colleagues are asking me where the copies, so I told them this is digital. So you get your copy digitally, online. Thank you very much.
May we appreciate the CS for Health, Honorable Aden Duale, and his team once more. A better round of applause, ladies and gentlemen. Thank you. Allow me to welcome Tabby and the band for one number as we prepare ourselves to welcome our keynote speaker, His Excellency Engineer Dr. Raila Amolo Odinga. Welcome, Tabby and the band.
Unaweza, Yesu, unaweza, hakuna kama wewe. Unaweza, Yesu, unaweza, hakuna kama wewe. Twakuinua, tunakupa sifa yoyo, unaweza, hakuna kama wewe. Unaweza, Yesu, unaweza, hakuna kama wewe. Tunakuinua wewe, unaweza, hakuna kama wewe. Unaweza, Yesu, unaweza, hakuna kama wewe. Tunakupa sifa, wewe mwaminifu, unaweza, hakuna kama wewe. Unaweza, Yesu, wewe tunakuinua, hakuna kama wewe. Bwana wa mabwana, unaweza, hakuna kama wewe. Tunakuinua wewe, hakuna kama wewe. Wewe kimbilio, nguvu ya wanyonge, hey, unaweza, hakuna kama wewe, unaweza. Yesu wewe, haleluya, tunakupa sifa wewe, unaweza. Yesu yoyo, haleluya. Weka makofi mazuri kwa Yesu. Anaweza yote. Haleluya. Inyalo duto, Rabi inyalo duto, onge machalo kodi. Ine matingi malo, ine miromo luongo yoyo, ine minyalo, onge machalo kodi. Inyalo duto, ngamalo ionge, inyalo duto, onge machalo kodi. Inyalo duto, inyalo duto, baba, onge machalo kodi. Yesu ine minyalo, inyalo duto, osiepoa, haleluya. Baba unaweza, 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 wewe kimbilio, unaweza, Yesu anaweza, Shinja mondo ni warano no. Taya. Ine malungi alungi. Taya. Ini winjori ine madendi kama. Taya.